All right, thank you everybody. My name is Drew Hoffman. I'm a manager with Pinnacle Healthcare Consulting and a board member with CHSM. And I'm here to talk about 50 Shades of Healthcare, consulting, insurance, physician practices, ACOs, corporate, and more. So I've been really lucky in my career to be exposed to a variety of different organizations, and all of them create a lot of value in the healthcare industry. I'm here to talk about some opportunities that might be outside of traditional organizations and maybe not the first things that come to mind when you think of pursuing a career in healthcare. So presentation goals, what are we here to accomplish? The first thing I want to accomplish is a strategic opportunity analysis. What does that mean? Basically, matching career goals to opportunities out there in the industry. To do that, we're going to develop familiarity with a concept called the value chain and perform some really rough probability type analysis. Also, hope to create some opportunities. So I hope everybody walks away from here with an expanded scope of the opportunities in the industry and a much higher probability of success. So why healthcare? Looking around the room, I think everybody's got some very diverse backgrounds. And just, out of curiosity, poll the audience, why have people pursued a career in healthcare? Anybody? Why not? All right.
I want to change it.
You want to change it? Okay.
I second that.
Yeah. Okay. Change. So identify the problem. Okay. Start a company. All right. I like it. So those are great examples. I've got listed here some of the the standard responses that you might hear for someone to look at healthcare opportunities as a career. So high salary, certainly lots of opportunity there. Job security, see lots of articles about the aging workforce, the baby boomers, larger and larger percentage of our GDP being spent on healthcare. It's not going anywhere. So job security, interesting work, cutting edge technology being developed, and also new ways, entrepreneurial ways to provide services. Career advancement and status, getting back to the fame comment, certainly some very prestigious positions, well-respected individuals in the industry for sure. Probably the number one thing that everybody can share who works in healthcare is the desire to help people. So how do you make a difference in someone's life and make their life better? So something everybody shares. So bear with me as an example. Let's say somebody decides to pursue a career in healthcare and their desire is to be a CEO of a hospital. So I think the first step in evaluating that career choice, let's go through some pros and cons of the position. So what are the pros? Certainly compensation, that's the first one that comes to mind for me. Probably the highest paid individual in the organization. Negative associated with that though, high turnover. I think the most recent number is around 20% annual turnover for hospital CEOs, so pretty frequent. You've got the status, the prestige with the position, also a lot of stress associated. The work can be extremely rewarding. You can make a huge difference in a lot of people's lives. There can be barriers to that success though in terms of politics and red tape on the downside. Hospital CEO is not going to get bogged down doing the same tasks every day. It's going to be very varied. A lot of people are attracted to that. I would caution there's a high number of responsibilities and it's easy to get overwhelmed. So once the individual has kind of done this pros and cons of the position, they've decided healthcare is right, hospital CEO, the pros and cons, still worth it. Let's do this. So what's the next step? What are my chances of being selected as a CEO of a hospital? So this gets back to Vince's comment about maybe the reality check, the gut check a little bit. So bear with me, here are some assumptions. According to the American Hospital Association, about 5,600 hospitals in the US. According to the US Census Bureau, 9.3% of the population has a master's degree. We'll also assume that's a requirement to be considered for the role. 10% of those master's degrees relevant to healthcare. So master MBA, healthcare leadership, health administration, something along those lines. Also a 6% vacancy rate at any given time for hospital CEO position. That puts you at just about 1.5 million professionals with graduate degrees relevant to healthcare. So with those assumptions, what are your chances of being selected as a CEO at one hospital? So let's think about your competition. There's 323 million people in the US. Remember, we said 9.3 have masters, about half between the ages of 30 and 65, so kind of that realistic age range to be considered. That's 14.4 million people. So if you compare yourself to that figure, one out of 14.4 million, the percentage is up there. I'm not really sure how to say that. It's got 5 zeros in it. So next, yeah. So I'm a gambling man. I don't like those odds. Jobs available. If you think back to the 5,600 hospitals, all with the CEO, and the 6% vacancy rate, that means at any given time, there's 336 openings. Once you select one of those 336, that's 0.003%. And when you combine those two numbers, there's the percentage, it's got 9 zeros. So understand, the chances of being selected at one individual hospital for a CEO role. But don't lose hope. Please don't lose hope. I'm not here to be pessimistic and bring everybody down. There's a lot of limits and drawbacks of a lot of things left out of the calculations we just did. Certainly things you can do to improve your chances of being selected as a hospital CEO if that's the path you decide on. What I do want to go through is a simple process that everybody can use. Everybody can replicate it based on their own individual career goals and desired industry, and really increase the number of options and opportunities they're considering. So that process is mapping out a value chain. So Rachel touched on the value chain a little bit in her presentation, but basically it's just a visual representation of all the activities a company does to create a product or service. And since we're talking about hospitals, the product or service we're creating is health. And so I think we'll look at the value chain starting with the patient's perspective. So how does the hospital create value from the patient's perspective? So up here, I've got a grossly oversimplified hospital value chain. Again, apologize for the eye test. It's again simplified, and there are a number of items left off. But I think when you think about how a hospital treats a patient, the first area is a provider. So when a patient presents in the ED, besides a receptionist and potentially a nurse or MA, the first person they're going to see is a doctor. And what all has to go in, what processes have to take place for the hospital to have a doctor there to see you? Well, the doctor has to graduate from medical school. The doctor might have been brought in from a recruiting company or a staffing company and either placed as an employee of the hospital or placed in private practice. The physician might be a member of a group practice that has privileges of the hospital, or a PSA or a call coverage agreement, some sort of relationship with the hospital. The physician might be a locums physician covering on a short-term basis for another physician that was out sick or couldn't be there for whatever reason. The physician you see could be a member of a practice that uses a management organization that allows them to focus more on patient care and offload the administrative duties and business responsibilities of running the business. And the physician is likely active in professional societies, engaging in CME and staying up to date on the most current treatments and technologies in their field. And so I'll stop there, and hopefully you can see as we walk through this exercise all of the different companies and activities that have to take place just for a physician to be there to treat you in the hospital. And what I would suggest is that you consider all of these different elements as potential opportunities for yourself to consider that may meet your career objectives or maybe even a better fit than a hospital CEO. I'll give you an example. If you're comparing being a hospital CEO to the administrator of a large physician practice, and your goal is to really get into the field and lead and change the industry, as everybody was saying, a practice administrator might be a better fit because you'll develop deeper knowledge in that field, and then you'll be part of a more nimble organization that's better positioned to lead change in the way patients are treated and diseases are cured. So now that you've seen the physician, you've told them what's wrong, the next step in the value chain is the physician will either run some tests to further diagnose the condition or move forward with some treatment. So to do that effectively, they're going to need equipment and supplies. So what needs to take place for the physician to have the necessary equipment and supplies to treat you? Well, the physician needs to be able to order the supplies and equipment and have them available. So the supply chain process is crucial. The equipment manufacturer needs to create the equipment and place it in the hospital. Pharmaceutical and medical device companies need to do what they do, develop the drugs or devices that'll be used to treat the patient. So you can see all of the lists with the equipment and supplies. Insurance, next step. You can't, now that you've seen the physician and you've been treated, who's going to pay? Who's going to pay for that? So that's where insurance comes in. So the most obvious area to consider in insurance is the patient's health insurance provider. Something maybe a little less obvious out there is working for employee benefits broker or consultant. So working with employer groups to get companies better rates and more comprehensive coverage for their people. Medical malpractice, cyber insurance, workers' comp disability, and you can see the rest of the list. IT could have gone anywhere. It encompasses all of the value chain, but you can see the list there of IT, all the different organizations coming together to make sure hospitals can effectively treat their patients. And then finally, you've got management and administrative functions. So billing, revenue cycle, real estate, compliance, on down to legal. So, takeaways. What do we want to accomplish? So that was just one isolated example for a hospital CEO example. That exercise can be replicated for any industry and matched up to any goal that you might have for your career. And hopefully what the outcome is a increase in the probability of landing a position that's beneficial for you because you considered more alternatives. So thank you.